Thanks for staying with us on TVC News at 7. Federal and state government and other stakeholders must work together and put in place necessary measures to ensure food security in Nigeria as the year 2021 approaches. This is the submission of speakers at the annual Farmers and Stakeholders Interactive Program organized for rural farmers in Osogbo, the Osun State capital. Rafiu Hamid reports.
More than a decade-long insurgency has continued to displace millions, leaving a large proportion in dire need of constant humanitarian aid. This opening ceremony is for a workshop to develop standard operational guideline for the Borno State Contributory Healthcare Management Agency. It has put all these factors into consideration in order to provide affordable and accessible healthcare for residents of the state.
The health systems of any country forms one of the indices for assessing the development of a nation. And the health system in the part of the country where we come from, I mean the northeastern part of the country, has been severely disrupted because of the activities of the non-state armed groups.
About 90% of the population of Borno State access healthcare through out-of-pocket healthcare financing, which is pushing more than 1.3 million Nigerians into poverty due to out-of-pocket healthcare expenditures.
A kind of intervention like this of the contributory healthcare management agency, such as to say, or the health insurance for the population of Borno State or the citizens of Borno State is actually a very wonderful plan in order to bring relief and succor to the populace of Borno State. This particular agency is here to bring a kind of a relief to accessible, affordable and equitable health care for all the citizens. That's what the law says, and then this is the mandate given to us by His Excellency the Governor, Professor Babagana Omar Zulum MNI.
You cannot build something on nothing. If you want to build, you will be building on something, and your foundation is the most important aspect of the sustainability of your structure.
The Borno State Health Management Agency has 3 sources of funding: payment of premium by enrollees, equity contributions from government and non-government sources, and a basic healthcare provision fund, which specifically targets the poor and vulnerable populations. The agency is expected to be a form of health support for Borno State residents who have been displaced and left vulnerable and need urgent healthcare the most. Kemi Balogun, TVC News, Abuja.